Dear students, let us discuss about the external features of the heart. In this picture, you are seeing the specimen of the heart, and this is the sterno-costal surface, and this is the apex of the heart, and this is the near at the base of the heart, and you are seeing the great vessels in relation with the heart. This is the ascending aorta and its continuation, the arch of aorta. This is the pulmonary trunk. This is left brachiocephalic vein, which is joining with the right brachiocephalic vein to form the superior vena cava. And these are the brachiocephalic, the left common carotid and left subclavian arteries that are originating from the arch of aorta, and this is the pulmonary artery coming from the pulmonary trunk. The word heart is derived from the Greek cardia and Latin cordis. That's why the branch of medicine, cardiology, is derived from that word. The heart is a hollow muscular pump that keeps the circulation going on, and it is the size of hand's fist of the same person, and it is situated in the middle mediastinum within the pericardial sac and above the diaphragm. In this picture, you can see the heart within the pericardial cavity, and then you can see the arch of aorta here. This is the right dome of diaphragm. This is the central tendon of the diaphragm. This is the right lung, and this is the left lung. In this picture, you can see the heart within the pericardial cavity. If the pericardium is removed along this dotted line, you can visualize the sterno-costal surface of the heart. So this is the sterno-costal surface of the heart. And in this picture, the right lung is pulled to show the right margin of the heart and its indentation in relation with the right lung. And this is the left lung, and this is the left margin of the heart. In this picture, you can see the pericardium is removed along this margin, and then you can see the sterno-costal surface of the heart. This is the apex of the heart, and this is the right auricle you are seeing. This is the origin of the ascending aorta. You can see the cut edge of the pericardium. The heart is conical in shape, and its orientation is oblique, and it is placed behind the sternum and costal cartilages. And if you draw a line in the midline, which you are seeing as the dotted line, 2/3 of the heart will be to the left of the median plane, and 1/3 is to the right of the median plane. The great vessels will be looking upwards, and the diaphragmatic surface will be looking downwards. So now you know the shape of the heart and its orientation, and how much of it is towards the left of the median plane and how much is towards the right of the median plane. And if you see the measurements of the heart, so from the apex to the base, it is about 12 centimeters, whereas the transverse diameter is about 9 centimeters. The anteroposterior diameter is about 6 centimeters. The weight of the heart is about 250 to 300 grams, and it is more in males. In this specimen, you can see the epicardial pad of fat. Then this is the right auricle, the ascending aorta, pulmonary trunk, and superior vena cava you are seeing. Coming to the various external features that can be discussed under the following headings. That is the apex, base or posterior surface, and the various surfaces of the heart and borders of the heart. Among the surfaces, we will be discussing about the sterno-costal surface, the diaphragmatic surface, the left surface, the right surface. Coming to the borders, there are the right border, left border, superior border and inferior border. In this picture, you can see that this is the apex of the heart, which can be seen from the anterior view. For seeing the base of the heart, it has to be turned back. The surfaces which you are seeing here is the sterno-costal or anterior surface, and this is the diaphragmatic surface that is facing downwards, the left surface, the right surface. Coming to the borders, there is the right border, there is the left border, the inferior border, the superior border is covered by the great vessels that are coming out or entering the heart. And in this specimen, you can see the formation of that superior vena cava from the left and right brachiocephalic veins. This is the superior vena cava, this is left brachiocephalic, and this is the right brachiocephalic vein. Each brachiocephalic vein being formed by the jugular and then the subclavian veins, which you are seeing here, and you can see the right and left lungs in this picture. So for studying the chambers of the heart, it can be divided into right heart and left heart. The right heart is concerned with pulmonary circulation, whereas the left heart is concerned with systemic circulation. So in each of these components, that is the right heart is having an atrium and a ventricle, which we call it as the right atrium and right ventricle, whereas the left heart, it also contains a atrium and ventricle. They are called the left atrium and left ventricle. In each of these, there is the inflow chamber and an outflow chamber. So the atria are the inflow chambers and the ventricles are the outflow chambers. So in these pictures, you are seeing the chambers, the external surfaces of the chambers, that is the right atrium, the right ventricle, the left atrium. Left atrium part, you are seeing the auricle, and then there is the left ventricle, and you know they are the great vessels. In relation with this, you can see the superior vena cava and inferior vena cava in relation with the right atrium. This is the, if you turn the heart specimen back, you can see the part in contact with the diaphragm. This we call it as the diaphragmatic surface. And this is the base of the heart, and which is contributed by the left atrium and the right atrium you are seeing. And you can see the superior vena cava and inferior vena cava that open into the right atrium. And you are seeing the 4 pulmonary veins that open into the left atrium, and the division of the pulmonary trunk into right and left pulmonary arteries are seen in this picture. Coming to the apex of the heart, it is directed downwards, forwards and to the left. This is the apex of the heart. So, which is directed downwards, forwards and to the left, and it is located in the left 5th intercostal space. about 9 centimeters or 3.5 inches from the median plane. That is the location of the apex. The chambers that are contributing for the apex, or it is solely contributed by the left ventricle. The pericardium and diaphragm separate the apex from the fundus of the stomach. So, the apex of the heart is close to the fundus of the stomach. And in this picture, you can see the superior and inferior vena cava, the pulmonary trunk, the ascending aorta, and the arch of aorta. Clinical importance of the apex is the apex beat. So, the clinical apex is the apex beat. What is apex beat? It is the impulse or the thrust of cardiac contraction during the ventricular systole, and it is felt as a light tap. In the case of adults, in the left fifth intercostal space, in the mid-clavicular line, just medial to the apex. So, and the heart is positioned obliquely. So, the adults, the apex beat will be in the left fifth intercostal space, in the mid-clavicular line, just medial to the apex. Then in the case of infants up to 7 years, the apex beat can be felt in the third or fourth left intercostal space, just lateral to the midclavicular line, and the heart is positioned horizontally in infants, whereas in the adults it is positioned obliquely. Dextrocardia. Sometimes the heart is malpositioned with apex on the right side. So instead of on the left side, the heart will be located on the right side, in which case the apex will be on the right side, not on the left side as is seen normally. So the apex is to the left of the midline, it's anterior and it is directed downwards, forwards and to the left. Coming to the base. The base is quadrilateral in shape. This is the base of the heart, and it extends from the bifurcation of pulmonary trunk superiorly to the coronary sinus inferiorly. The direction of the base is backwards and slightly to the right, and base of the heart lies opposite the middle 4 thoracic vertebrae, and it is separated from the posterior mediastinum by oblique sinus of pericardium. So recollect the oblique sinus of pericardium that was discussed during the lecture on pericardium. In this picture, you can see the left atrium with 4 pulmonary veins opening into it, and then the right atrium with the superior vena cava and inferior vena cava opening into it, and this becomes the diaphragmatic surface, which is contributed by the right and left ventricles. And at the junction of the atria with the ventricles, there is the atrioventricular groove or sulcus, and posterior aspect, it contains the coronary sinus. So the boundary for the base of the heart is between the bifurcation of pulmonary trunk above and the coronary sinus below, and it lies opposite the middle four thoracic vertebrae. In this picture, you can see the formation of base by the two atria, and it is mainly by the left atrium which contributes for 2/3 of the base, and it receives the 4 pulmonary veins you can see in this picture. The right atrium contributes for only 1/3 of it, and it receives the superior vena cava and inferior vena cava. This is superior vena cava and this is the inferior vena cava. So the base is contributed by left atrium 2/3 and right atrium 1/3. And if you see the base above, you are seeing the bifurcation of pulmonary trunk, and below is the posterior part of coronary sulcus, which is also known as the atrioventricular groove that lodges the coronary sinus, and also the anastomosis between the right coronary artery and circumflex branch of left coronary artery. The boundary for the base on the right side will be the right border of heart, and the left side is the left border of the heart. Coming to the surfaces. After learning about the apex and base of the heart, let us look into the surfaces. The surfaces are the Sterno-costal surface, Diaphragmatic surface, and the right and left pulmonary surfaces. So this is the Sterno-costal surface. The diaphragmatic surface will be in contact with the diaphragm. The right and left pulmonary surfaces are in relation to the lungs. Coming to the Sterno-costal surface, this is the most anterior surface, and it lies behind the sternum and 3rd to 6th costal cartilages. It is divided by the coronary groove into atrial part and the ventricular part. The atrial part is contributed by the right atrium, and the ventricular part is contributed by both the ventricles, that is both right and left ventricles, but mainly by the right ventricle. If you look at the diaphragmatic surface, so it is flat and it will be resting on the central tendon of diaphragm, and left 2/3 of this surface is formed by the left ventricle and right 1/3 by the right ventricle. The two ventricles are separated by posterior interventricular groove which lodges the posterior interventricular artery and middle cardiac vein. So in this picture you are seeing the diaphragmatic surface. This is the diaphragmatic surface and this is the base of the heart which we have learned. And you are seeing the coronary sulcus with the coronary sinus, and this is the posterior interventricular groove separating the right and left ventricles which lodges the posterior interventricular artery and the middle cardiac vein. These two are the specimens of fetal heart which you can see for the base. This is the base of it and this is the posterior interventricular groove and this is the coronary sulcus containing the coronary sinus. Here also you can see this is the base of it, and then this one is the posterior interventricular groove containing the vessels. Coming to the pulmonary surfaces, there are left and right pulmonary surfaces. The left pulmonary surface is formed by left ventricle and it forms an impression on the left lung. Whereas the right pulmonary surface is formed by right atrium and it also presents an indentation on the right lung. After learning about the surfaces of the heart, that is Sterno-costal surface, the diaphragmatic surface and the right and left pulmonary surfaces, let us consider about the borders of the heart. So there are the 4 borders of the heart. So this is the upper border, this is the right border, this is inferior border, and this is the left border, which you can see in the specimen of the heart. Here also this is the superior border, which will not be seen because of the origin of these great vessels which you are seeing. And this is the left border, and this is the inferior border, and this is the right border. And in this specimen you can see the right auricle and also the left auricle. What will contribute for the borders? Let us see. The upper border is a straight border and it is formed by 2 atria, but they are concealed by the ascending aorta and pulmonary trunk. The lower border, this is the lower border which is concave and is formed by right ventricle and small apical part of left ventricle. So this is the lower border. The right border is convex and it is formed by right atrium and it faces the right lung, and this extends from the inferior surface or diaphragmatic surface to the base of the heart. The left border is convex and it is formed by left auricle and left ventricle. This will be facing the left lung, and this extends from the base of the heart to the apex. So that is about the 4 borders of the heart. After learning about the base, apex, the 4 surfaces and the 4 borders of the heart, so what are grooves and sulci that are separating the various chambers of the heart on the external surface, external demarcation of the various chambers of the heart? So there is interatrial groove separating the 2 atria which cannot be seen and it is concealed by these great vessels. Then there is the interventricular groove, so which is seen both on the sterno-costal or anterior surface and the inferior or diaphragmatic surface. So that is anterior. One is called the anterior interventricular groove, and on the diaphragmatic surface it is the posterior interventricular groove. Then there is the atrioventricular groove that separates the atria from the ventricles. What does these grooves or sulci contain? They contain the blood vessels and variable amount of fat. So the boundary between the chambers of the heart or the coronary circus which encircles the heart, which is the external boundary between the atria and ventricles, It is also known as the atrioventricular sulcus. Then the anterior interventricular sulcus, which is a shallow groove on the anterior aspect of the heart, and it is the boundary between the right and left ventricles. Then on the posterior surface is the posterior interventricular sulcus, which is the external boundary between the ventricles on the posterior aspect of the heart. Now let us see the flow of blood into the chambers of the heart. The right atrium receives the deoxygenated blood from the upper half and lower half of the body through the superior vena cava and inferior vena cava, and from the right atrium it passes through the tricuspid orifice into the right ventricle, and from the right ventricle it passes through the pulmonary orifice into the pulmonary trunk, and then through its divisions into the right and left pulmonary arteries, this deoxygenated blood will reach the right lungs and left lung. So that is about the pulmonary circulation. And then the oxygenated blood from the right and left lungs reaches the left atrium through the pulmonary veins. So there will be two pulmonary veins on each side. So two pulmonary veins on the right, two pulmonary on the left. They open into the left atrium, and from the left atrium the oxygenated blood will reach the left ventricle by passing through the bicuspid orifice. And from the left ventricle it passes through the ascending aorta, arch of aorta and its branches, that is the brachiocephalic, common carotid and the subclavian. It will be reaching the upper half of the body, and the remaining part of blood it passes through the descending aorta, through the thorax and abdomen, and it supplies the lower part of the body, and this circulation is called the systemic circulation. So that is about the flow of blood in the chambers. So we have learnt about the external features of the heart, and you have learnt what is pulmonary circulation and what is systemic circulation, and how the blood flows in the various chambers of the heart.